Hello judges, I'm Anand Bhogal and I'm doing HOSA clinical specialty. My chosen career is orthopedic surgeon, and I'm from Troy, Michigan, and I go to International Academy East, and I'm in Region 16 in the secondary division. And now basically I'm going to tell you what an orthopedic surgeon is. So an orthopedic surgeon or orthopedic surgery is someone where they specialize in the prevention, diagnosis, and treatment of disorders in the musculoskeletal system, and which could include bones, tendons, ligaments, and joints, and muscles as well. And basically, if a patient does not respond to a non-invasive therapies like physical therapy or maybe shots, it may be necessary to recommend surgical treatment. And orthopedic surgeons who specialize especially in the knee have deep clinical expertise in understanding sports injuries that result in acute or long-term damage to the knee, and requiring replacement of the knee or meniscus, for example, to enable the patient to recover mobility and be able to do certain sports activities again. So for me, I found personally that I love sports, and I thought sports medicine would be something that's cool. And I thought that, hey, what's a career that could tie in sports, but then also be something that fits in my personal strengths? And that's where I came up with orthopedic surgery within sports medicine. And so my uncle, Dr. Patel, he basically is an orthopedic surgeon, and he also does it in sports medicine, and he specializes in the knee. And from talking and interviewing with him and learning all the things about him, I'm like, hey, wait. He says you have to be caring, kind, and compassionate, and also have care for a lot of people. And I know that I'm caring because a lot of people tell me, but also 2 years ago, I took care of my mother when she had COVID for 2 months when I was in 8th grade, and I kind of dropped school for a little bit, but that was also something I wanted to do to help her feel better. But then also, I love sports. I'm excited. Soccer is my favorite thing in the world. I love being active, and whenever I get a chance to do something with sports or do anything, I want to do it. So it's like kind of brings two of the best worlds together. So it brings who I am as a person, what I've been taught by my family and my mother, and also with one of my greatest passions in life, which is physical activity. And so some of the characteristics to be an orthopedic surgeon is to be diligent, organized, and to be diligent and organized, you have to know that, hey, also confident and compassionate. So to be diligent, you have to know their clinical area and excel in education and hone skills. So I'm very diligent. Not everything, but a lot of things I'm very diligent at. Like when it comes to my soccer practice, I'm diligent. I'm practicing all the time, making sure I learn everything. When it comes to school, I'm trying to be as diligent as possible. Maybe I can work a little bit on my time, but I'm able to get everything done. I want to learn as much as possible. And then confidence. I have lots of confidence. I'm being confident right now talking to you guys, and I'm very confident that did a lot of research, did good interviews, did an amazing skill video, and I have lots of self-confidence, and that's needed because when you're going into surgery and opening somebody up, then you can't be nervous. And you have to be compassionate because there's going to be a lot of people that are scared and nervous when you're doing surgery, whether it be even for a sports injury or something like that, because they're going into an unknown that they've never experienced before to a random person that all they know is a doctor that have been doing it for a long time. And you have to be compassionate and understand that, hey, you have to comfort them and be like, hey, I understand it's a worrying process, but what I'm going to do, it's going to make you feel better, and everything's going to be fine after this. So please trust in me. You have to be compassionate. So now going back to what orthopedic surgeon is, the education and training is very, very important. So basically, you would get an undergraduate degree in biology or chemistry or pre-med, which is recommended for 4 years of study. Then you graduate and go to accredited medical school for 4 years. Then you do an orthopedic residency for 5 years of study at a major medical institution. Complete 2 years of specialized orthopedic surgery, such as knees or others. Then continue with a specialized orthopedic fellowship optional, and then pass a state medical licensing exam / medical board exam to become then a full-fledged orthopedic surgeon. So after completing the residency, the American Board of Orthopedic Surgery offers a written test to become a board eligible. That's very important because once you pass the test, then you can finally be a full orthopedic surgeon. All the years of training have paid off. So career outlooks in orthopedic surgery could be things like orthopedic surgeons can serve patients in hospitals as a member of staff, or they can be in like their own private clinics. They can do like pediatrics, sports, shoulder, elbow trauma, hand, hip, knee, spine, or orthopedic oncology. So there's so many things within it. And now going back to some more responsibilities of an orthopedic surgeon, they must be ready to address complications during and after surgery as well. That's the key thing, because they're not just there for the time of the surgery. You have to be ready to deal with problems before and after. And now going back to my skill video, where I talked about where the whole goal of me was to go over and discuss the differences between a minimally invasive and a total knee replacement, and show why the minimally invasive is better. So as you see here, in my first, at 4 minutes, about 4 minutes, 55 seconds, I did a physical examination. So I'll play that for 1 minute.
Oh, that hurts a lot more.
And then if I skip forward, then I go over and look at the scans. These scans are right here. I compared a normal right knee with a right knee with an eroded meniscus at about 0.25 inches, and I showed with the grinding and everything and how why the pain's being caused, and then why I want to do a minimally invasive, because it would cause less damage and produce less risk for the patient and potential complications. Sorry, excuse myself. Very sorry. So a daily schedule of an orthopedic surgeon is 6 to 7 a.m. or 8 to 6 p.m. So very round and all around the clock. And how orthopedic surgery fits in the medical field is because without orthopedic surgeons, people to treat your body and perform these things on your muscles and tendons and bones, who's going to heal you when you have problems that can't be fixed by just doing non-invasive things? Because sometimes you need people to cut you open and fix your problems. And without that, there's not a lot to be done. But also orthopedic surgery, there's not enough training opportunities, but a lot of demand for orthopedic surgeons. So if later on in the future, if more training comes up, there's a lot more opportunities to be an orthopedic surgeon. And all I want to say is I had an amazing time doing this, and I had lots of fun. So judges, thank you for my presentation.